Hi, I'm Dr. Hyman, and I wanted to give you a little description of what the actual procedure of a circumcision will be like. A lot of people are very afraid of this, and I think just in walking you through it, it will give you a little more comfort with the idea of having it done. The first step in doing a circumcision, of course, is to provide you with a penile block. This means that I'm going to give you a numbing injection, kind of like a dentist would do, but I actually do initially a little preparation block. What that means is that I'm going to give you a tiny injection at the base of the penis with the smallest needle pretty much out there, a 33 gauge needle. And what this will do is just create a tiny little, it's like a tiny little raising of the skin at that level. And it allows me to put in a larger needle so that you won't feel the pain of the large needle going into the penis. That needle will go in deeper and fill the shaft of the penis with the numbing agent, and it will literally numb up the entire penis. I'll do some tests, of course, to be sure that you're truly numb, and then we will begin the preparation process, which means using a little iodine solution to sterilize the skin and then create a sterile field with sterile towels. While this is all happening, of course, I'm going to be discussing it with you in real time, just so there's no surprises. At that point, I'm gonna make the first incision, and of course I'm gonna make sure you don't feel anything before I even begin. That first incision is with the foreskin pulled all the way over the penis. I'm gonna make that incision just behind the head of the penis. And then I'm gonna pull the foreskin back, and then while it's pulled back, I'm gonna make a second incision around the shaft of the penis, just behind the head of the penis. So now we have two circumferential incisions, one on the outside of the foreskin when it's pulled over the head of the penis, and the second one when you pull your foreskin back, I'm gonna have a second incision there. And then what I'm gonna do is I'm gonna basically use a special instrument to connect those two incisions and then remove that cuff of foreskin, okay? Essentially the entire foreskin, but it's sort of like a cuff of skin. And that cuff of skin gets removed and passed off of the field. And then the final step will just simply be to stitch those two edges back together. There's a little skirt of skin left behind the head of the penis and a shaft skin that's, on the, what we call the proximal side of the penis, the shaft skin. And those two edges of skin are brought back together with little stitches, individual stitches all the way around. Usually takes about 12 stitches all the way around. In the middle of all of this, I'm checking for bleeding, and if need be, sometimes I'll use a little cautery in little point areas. Again, you're not going to feel any of that. And once those stitches are all completed, I will then wrap everything up in a bandage, and the procedure is done. So that's exactly how it takes place. And if you have any questions, by all means, call us on the website. I will very often be the one to return the call. Okay, thank you.